Hello, Fort Belvoir. Welcome to Belvoir in the Know, the only podcast created especially for the Fort Belvoir community to help you stay in the know and on the go. I'm Command Sergeant Major Greg Kleinholz, the Garrison Command Sergeant Major.
And I'm Colonel Josh Seagraves, the Garrison Commander. Very special podcast today. Special guests, Dr. Shaprina Williams and Lieutenant Antoinette Mantz from the Fort Belvoir Community Hospital. We are very excited to speak with both Dr. Williams and Lieutenant Mantz today on the very important topic of COVID-19 vaccines for children. Probably questions on everyone's mind. So, Dr. Williams and Lieutenant Mantz, thank you for joining us. Tell us a little bit about your positions and role at Fort Belvoir Community Hospital. We'll go with Dr. Williams and then Lieutenant Mantz. So, Dr. Williams, over to you.
Hello, everyone. My name is Lieutenant Colonel Shaprina Williams, and I am the Chief of the Department of Pediatrics here at Fort Belvoir Community Hospital, as well as an adolescent and young adult medicine provider.
Hello, this is Lieutenant Mantz. I'm a registered nurse and officer in charge of the COVID-19 vaccine and flu vaccine missions here at Fort Belvoir Community Hospital.
Awesome. Two things you've gotten very good at over the last 20 months and very familiar with the community center. So excellent. So let's just jump right in. With the recent approval from the FDA, I understand that Fort Belvoir Community Hospital is offering the Pfizer COVID-19 vaccine to military children ages 5 to 11, and that the Fort Belvoir Community Hospital is one of the first military treatment facilities offering the pediatric dose. So what's the first thing you'd like parents and children to know about the Pfizer COVID-19 vaccine for children?
Well, yes, sir, you're absolutely correct. We are offering the Pfizer-BioNTech COVID-19 vaccine at Fort Belvoir Community Hospital. It's currently the only vaccine that's been granted emergency use authorization for children 5 to 11. And children who receive the Pfizer vaccine will get a dose that's 1/3 of the adult dose and will need 2 doses that are given at least 3 weeks apart.
That's really good information as parents are trying to determine what to do. So, why should a parent vaccinate their child when it seems like fewer children have been sick from COVID-19?
Well, vaccination is really the key to actually ending the pandemic. New variants, such as the Delta variant, will continue to emerge as long as the pandemic continues. So a future variant may pose a greater risk to children. And there are some children who are already at a greater risk of developing severe to moderate disease. And studies have shown that the vaccine actually helps decrease that risk of developing severe disease. Also, children who are vaccinated can help keep their family members safe, their school safe, as well as their peers and their communities safe. And they can also return to routine activities like playing sports, hanging out with their friends. And all of these things are actually good to kind of help support their mental health.
Great point. Great point, Dr. Williams. So I know a lot of parents probably wonder, how can we vaccinate our children with confidence, and how do we know the vaccine is safe?
That's a great question, sir, and certainly something I know a lot of parents are thinking of. While the COVID-19 vaccines were developed rapidly, all steps have been taken to ensure their safety and effectiveness, including clinical trials that did involve children and adolescents. The trials have shown that these vaccines are, in fact, safe and effective. Actually, COVID-19 vaccines have been used under the most intensive safety monitoring in U.S. history. We started administering the COVID-19 vaccines to children aged 5 to 11 about a week and a half ago, and it's going great. We have taken and continue to take every precaution to ensure your children's safety while receiving their vaccine with us. And bottom line, the risks associated with getting a COVID-19 infection far outweigh the risks of vaccination.
That's a lot of good information, ma'am. And if I was wondering, about those specifics, and now I want to vaccinate my child, how can parents get their children vaccinated against the COVID-19?
Well, CSM, I'm glad you asked. Our COVID-19 vaccine clinic at the community center continues to offer the COVID-19 vaccine to our pediatric patients. Parents can schedule an appointment online, and the link will be available with this episode. You can also find the appointment link on our Belvoir Hospital Facebook page. That's also shared on the Garrison Facebook page. The latest and greatest information on our clinic location and hours can also be heard on our Vaccine Information Hotline, which will be shared as well.
Great, thank you.
Yeah, good. That's a really good, a lot of good information there. So is there anything else you'd like to share with the audience?
Yes, there are a few other things that I would like to share. First of all, it's really important for you to let your child know what to expect when he or she goes to get the vaccine, just like when you take your child to receive a vaccine by the primary care provider. And also just be aware that after your child receives the COVID-19 vaccine, that he or she will be asked to remain in the area for about 15 or 20 minutes to be observed, just in case he or she develops a reaction or a severe allergic reaction to the vaccine. Developing a severe allergic reaction is very rare. The more common side effects would include potentially swelling, redness, or pain at the injection site, fever or headache, feeling tired, maybe having some muscle pains, chills, or nausea. However, a lot of children won't even experience any of the side effects. Also, it's really important for you to remember to continue to follow the CDC's guidelines, such as washing your hands frequently, as well as social distancing as much as possible, and wearing a mask when you're unable to maintain the appropriate social distance. And it's very important to remember to do these things during the upcoming holidays as well. And lastly, I want you to know that it is okay for your child to receive the influenza vaccine along with the COVID vaccine, as well as the other recommended childhood immunizations.
And speaking of the flu vaccine, I'll also add the final day of the flu vaccine clinic at the Fort Belvoir Community Center will be November 24th. If you or your family still needs the flu vaccine, don't worry, it won't be too late. Patients of the Family Medicine and Pediatrics Clinic can get their flu vaccine with their primary care clinic, and patients of the Internal Medicine Clinic can receive their flu vaccine at our hospital's Allergy and Immunization Clinic.
Great, great. A lot of capped it off with a lot of good information there about both vaccines, COVID and the flu. I think that pretty much wraps it up and kind of brings us to the end of another really good episode. I want to thank both of you again for joining us today and taking a little bit of time to help to continue educate the community and, you know, hopefully continue combating the pandemic. So thank you again for joining us. Sergeant Major, any final thoughts?
Yes, sir. It's very heartening to know that when parents have questions in regards to the vaccine or really anything that has to do with the hospital, that we have these two great professionals and all the other professionals at the hospital who can help answer those questions so they can make a joint decision with their children on whether or not to get vaccinated. So thanks for joining us today.
Yeah, absolutely. Really well done. And once again, appreciate the information. So as always, we'll end with some reminders for our listeners. Don't forget to download the digital Garrison app and make Fort Belvoir your installation of choice so you can access updates on our upcoming events, emergency updates, and other podcasts, as well as other useful information. Connect with us on our website and social media for all things Belvoir. Follow the Fort Belvoir Community Hospital social media platforms to stay informed on all COVID-19 updates. Remember to, as Colonel Williams said, wash your hands, wear a mask, and physically distance where appropriate, particularly with the holidays coming up. And finally, thanks for joining us. From me to you, and now you know.